Rich, good morning.
Morning. How are
How's
you
your
doing?
weekend?
It was great.
What you got going on today?
Yeah, so today we have a great case to start off the day. It's a tertiary rhinoplasty.
Tertiary, so that means third time. So
And in order to
is that
kind of
easier or harder?
definitely a little bit more challenging than someone who's not had one before.
Yeah, yeah.
And so in this patient, they have a couple concerns about the way things have been developing over time, the appearance of the nose, as well as the function of the nose. So we're going to do some pretty advanced maneuvers to achieve her goals. One of them being we need more material. This person previously had a septoplasty, so I'm gonna actually be harvesting some rib today, small incision in the chest here, in order to get that cartilage that we need to reconstruct the nose. Also doing a little chin implant to kind of balance
Very
out
nice.
things.
So that's an important thing to think about when you're looking at a patient and trying to create facial harmony. Our goal is not to make somebody look augmented. It's actually to give them balance. So adding balance to the lower third helps balance that middle third and really gives them an elegant look. You mentioned rib graft. This is an important thing that I think patients need to understand. What's the purpose of the rib graft? It's the analogy I want to give is like the house. You're building a house. What do you need in that house before you put it up?
Exactly. So when you think about the nose, there are a lot of structures naturally that have cartilage in them. And so using the cartilage is not meant to make the nose look wider or bigger. Sometimes it is used to kind of improve the airway. That's important, but also to build the structure of the nose, make sure the tip is where you want it to be, that it holds up over time. Also improve straightness. So those are the main goals in using that cartilage.
Yeah, and it gives you foundation so that there's stability, and it's not like when she gets this procedure, this should be her long-term outcome, and that's kind of how you were trained and how I've been trained also. And from a standpoint of revision procedures, now that's something that we do a lot of at HKB, and they can be very challenging, but sometimes they can be the most rewarding, right?
Yeah, just like you've definitely treated a lot of revision patients too. These patients often have gone through some level of understanding of prior operations and what it takes afterwards. So often they are the happiest patients in the end because we're making things better again for them.
Right, and the purpose of us, we were talking about this earlier, why we wanted to film this video, is that I think patients need to understand that we understand that in situations that patients have undergone a procedure and they've had a kind of satisfactory outcome, but maybe they're not totally thrilled with it, or some time has gone by and they still are insecure about it. Those are times where they can at least reinvest some time and effort into seeing what's possible. But more often than not, we can actually improve those results. And this is not knocking the work that they had before, because sometimes things change. Sometimes there are some fundamental anatomical issues, but there's always typically a way to improve something. And if that's going to help them, I think that they should consider it.
Yeah, I'm always happy to talk to patients about these kind of situations, and often these patients have talked to other surgeons about this too, and that helps to kind of reaffirm maybe some of the potential game plans that they can go through given their situations.
Right, and there's always an opportunity cost. We recognize that there's an investment in time, investment in recovery, but sometimes to see a patient come in and be so happy, so confident after you make these small changes, I mean, that's why we do this. That's why we are literally in business, and sometimes revision patients, and actually, like you said, more often than not, are some of our absolute happiest and the ones that we can enjoy a lot of.
Yeah, definitely. I've definitely found that to be the case for sure.
All right, let's go rock it.
All right.